Welcome to episode 11 of the Progression Health Podcast. I'm here with Susan Dopart, and she is an MI researcher. Susan, I hope I pronounced your name right, but will you introduce yourself to the listeners?
Sure. I'm Susan Dopart. I am a health and wellness consultant and a certified motivational interviewing trainer and diabetes educator, and I'm based in Los Angeles.
Very good. Yeah, Susan is extremely experienced, especially with something that's really useful like MI. And I was fortunate enough to come across it and do some of Susan's courses, which I'd highly recommend. So we're going to get into a little bit of MI, what it's all about, and Susan's experience. So you're a health and wellness consultant. Um, as you said already as well, you're certified in motivational interviewing. You're a very highly experienced trainer, and you're a certified diabetes educator. Where would you like to start there with all of your experience?
Whatever you'd like to do, Ross, it's perfectly fine with me. Wherever you'd like to make that happen. And by the way, thank you for having me on your show. It's truly an honor.
Oh, I'm delighted to have you on. It's always great to talk to you. So Susan, your health and wellness consulting. What's kind of like some of the main things you talk about with people? Like what would be like a typical consultation topic you have with clients?
Mhm. Well, I feel like, especially with all that's going on in our world, people have very complex medical issues now. And so my specialty is diabetes, but I feel like I see so many people now with complex gut issues, such as bacterial overgrowth, people actually with mold related illnesses, parasites, things I never imagined myself talking to people about. But um, the gut issues, um, diabetes, menopause, cancer, Alzheimer's, heart disease, the list goes on and on. But the main thing with many of these health related illnesses is something called insulin resistance, which is a driver for many metabolic diseases. And, I can go over that now or later if that's something that you're interested in hearing about.
Yeah, sure. It definitely would be interesting to get into the mechanisms of a lot of the health related issues.
So, insulin resistance is something that um, people are usually born with. And how it works is people are born either what's called insulin sensitive or insulin resistant. And usually it's to do with genetics. It can be due to the mother being insulin resistant or insulin sensitive, what the mom eats while she's pregnant, believe it or not, because conception starts in the womb and or starts at conception, and also how much weight she gains and how much weight the baby is at birth. So people that are, just to give an example, people that are insulin sensitive, when they eat a bowl of cereal, their pancreas, which is the organ which produces insulin, secretes just the right amount of insulin. It gets burned off and metabolized. But that doesn't happen with people who are insulin resistant. They eat the same bowl of pasta, and there's a bit of a delay in the food getting into the cells. So what happens is the pancreas gets a signal of the delay and over secretes insulin. So what happens is that triggers a host of inflammatory issues because of all the extra insulin in the bloodstream, and causes the person to be predisposed to more fat gained. But what also happens is the extra glucose that's sitting in the bloodstream has to go somewhere, so the liver takes it up. So the liver, when it gets full of glucose, it can start the train towards fatty liver, but also predispose the person towards higher levels of cholesterol and triglycerides. Right? And what happens is when a person who's insulin resistant, every time they eat, even no matter what they eat, whether it's carbs or, you know, um, protein or even a little bit of fat, their pancreas secretes insulin. So we say the less often they eat, the less they expose their body to insulin, which helps with control of the insulin resistance.
Interesting. Yeah. So then Is that where the condition non-alcoholic fatty liver disease comes from? Is that something you see in
Mhm.
your clients?
Exactly. And the interesting thing is non-alcoholic fatty liver disease was not even a diagnosis, I believe, before 1980. But now it's quite prevalent. And they say that it's actually prevalent in many children, even as young as 5 years old, because of all the carbs and sugars and fructose and processed foods in our diet.
That leads me on to my next question. So, what do you think is the cause of the higher rates? Is it fair to say diabetes is on the rise? Sorry, type 2 diabetes is on the rise. And then also, what do you think would be the cause behind that if it is on the rise?
Mhm. Definitely, diabetes is on the rise, and they say by the year 2050 that almost 50% of the population will be type 2 diabetic. And the driver is all our food, our processed foods, the way our animals are fed, all the carbs and sugars in our diet, and basically the lack of integrity of a whole foods, real food diet. People not eating vegetables, not eating healthy sources of protein and healthy fats, but defaulting to processed and fast food, which is more the norm rather than the former. And if I think if people want to eat healthy, healthier, they have to be extremely intentional about it. And it takes a fair amount of discipline to do that.
Yeah. Something I'm noticing with my clients is that they're very busy, they're working a lot, especially clients working from home. It's kind of like um, the culture here in the Bay Area is to be busy all the time. Just even like, some of my clients would have said, um, I get like a day off or I finish early and it's kind of like I'd nearly rather be busy just working. So that relationship with work, I think it's very like unhealthy, and then it leads to having less time to do like things that you value, such as cooking. So is that something you notice with your clients, and how do you get clients to, I guess MI will tie in here, but
Mhm.
how do you like get a client who wants to be healthier to kind of make more time for their health?
Mm. And that's an excellent question, Ross. And it's a very complicated answer, and it's really different for each person. And I think it all ties back to values. Is there's something called a double-sided reflection with motivational interviewing, where you talk about someone's ambivalence on the first part of what we call a reflection or a summary back to them. And on the second part, you use the values. So on the one hand, you're really busy, making your meals is challenging for you. And on the other hand, you really care about your health, you care about your weight, and you're wondering the best way to be able to take care of that. So part of the essence of MI is evoking in someone what their value is and their own wisdom about their health and what would make sense to them.
Yeah, very interesting. I love the idea that the client is their own expert in their own life,
Hmm.
and that'll always be the case. That's like a really empowering sort of thought. So would you just give a summary of what motivational interviewing is, what benefits people can see by learning about or applying motivational interviewing to their own lives, and any other relevant info you can related to MI?
Sure. Well, MI it was developed in the addiction field by a man named Bill Miller. And he started to notice, many years ago, he subscribed to the work of Carl Rogers, who was a psychologist in the 50s and all about client-centered therapy. And he realized early on that just telling people what to do doesn't work. One of the quotes I love is advice is the junk mail of life, right? Nobody wants to be told what to do, but yet we're so quick to do that. We're so quick when someone's describing a problem to give them a solution, which we call that in motivational interviewing the writing reflex, that little helpful hint. Have you tried this? Have you tried that? And it's human nature if you tell someone what to do that they're going to tell you why it doesn't work. And the problem with that is they actually become more committed to their ambivalence when they say it out loud, why something doesn't work. So that's why we actually avoid telling people what to do, because it can actually cause them to go in the other direction. Right? So motivational interviewing, it's basically a collaborative partnership conversation to help evoke someone's own wisdom for change. So if someone says, they come to me for a diet issue, but then they might say something like, well, I quit smoking 20 years ago. That's a huge 911 about how they've been successful in the past. So I'll say, okay, when you quit smoking, what did you do? What was different? So I'm trying to get them to activate that part of their brain about how they are successful. Right? So they may say, well, I did X, Y, and Z. And just them saying that out loud helps activate their brain, like I said, but it reinforces to their brain that they can be successful and how they were successful. And then if I summarize back to them what they said, it's a double reflection to the brain about how they can be successful with the current quandary or the current change, which is so much more impactful than any piece of information that we could ever give them.
Brilliant. Yeah, you're bringing back all the stuff we learned in your course. It's actually getting me kind of excited because I feel as though they're like invaluable tools to navigate like relationships, which can be tricky, at the best of times. And I want to play devil's advocate and kind of like, highlight to people how effective the tools are. But will you just first talk about the spirit of MI? Because that's what I'm really hearing from what you're saying. You have a very sort of particular way of speaking that I feel like is it's in the spirit of MI really.
Mm. Yeah, and the spirit is something that was developed, in the first edition of MI and has been carried throughout. And we say without the spirit of MI, all the skills are lost. And it's really the spirit is, how do you have collaboration with a client, evoke their own motivation for change in a kind, compassionate way, right? And the partnership piece is one of the, in my opinion, one of the most important pieces of the spirit of MI. Um, and we call it having equal power sharing in the relationship, that yes, I'm an expert in nutrition or whatever field it is, but I don't have an expertise in you, right? And so together, how do we walk down this road so that we find the solution that best works for you? And I think what happens is people use a lot of I statements, like, I think you should quit smoking or quit drinking, rather than, you're wondering what um, being sober might mean for you, what that might be like for you. That's partnership, whereas the former is being the expert.
Yeah, it almost feels like all the advice of MI is counter to everything that we pick up in society, communicating with each other, all these kind of bad habits, really. Um, so let's say, for example, in some of your work, I know you said you worked in prisons and you work with people with addiction. So typically, I feel as though someone from the general population would say, "Oh, someone with an addiction, they need expert advice, they need expert help. Should they can't help themselves, or they're just completely incapable. They're consumed by the addiction." So, what would you say to someone who has that view and is like, even something simple like a parent-child relationship? It's like the parent's like, I'm the expert, I'm experienced, I know best. But as you say, we'll just call it like the client is the expert of their own lives. Um, what happens when you kind of don't follow the spirit of MI and the guidelines within MI, and you approach a conversation as the expert and you don't let the other person have autonomy?
Hmm. Well, the number one reason why people change is empathy on the part of the professional, right? And so we always have to be empathetic and caring and kind to people that we work with. And if we act as the expert and tell them what to do, we injure what's called the working alliance, right? And the working alliance is how people change. And, I usually ask people who start to rave about their doctor or their therapist, I'll say, what is it about them that you like? And they'll say, they get me, they know me, they understand me. They don't just give me lots and lots of information or advice. And they even remember things about me. They don't have to look in my chart, right? And so that tells me that professional is working in a collaborative partnership way, which makes the client want to go back, right? And I think Bill Miller, he said this recently, I heard him say this, that the person with all the answers is in the room with you, right? And they may have forgotten their answers. So we have to sometimes evoke it from them. So for example, someone who has an alcohol issue, I'll say, when you've had a day when you were sober, what was different about that day? What helped you? And sometimes they'll say, well, I don't know. But usually they'll circle back, their brain will start to work on it, and then they'll say it out loud, which helps them remember how they were sober that day. Right? And that's the beautiful part and the spirit of MI is evoking people's past successes so that they can leave your presence thinking about it in a brighter way and having more hope. And that's the one really beautiful thing about MI is we always have our eye on the or our eye on the horizon for hope for people who don't have hope for themselves. And we hold that hope inside. So every time they leave our presence, they leave with a little more hope.
Great, yeah. I'm doing a little bit of reading about self-compassion. Kristen Neff, the kind of the lead researcher for self-compassion, has a lot of good articles and publications. So I feel like, having read about self-compassion, I feel as though it's like severely lacking in the general population. Even in myself, for example, I'd love to be able to be less. I'd rather buy into the culture of like hard work is better. I'd rather be like, you can give yourself a break every time you need it. So why do you think it is that do you think people lack self-compassion, and why do you think that is? And why do they lack hope? Where is that coming from?
That's the $1,000,000 question, right? But the fact that you're researching compassion, Ross, and talking about how you want to do that shows that your brain, your neural pathways are really working towards something that you truly desire, and you're starting to go against what's been a default response to you. So you just saying it out loud shows that you're going to be able to do that.
Hopefully.
Yeah. And that's called an affirmation. And part of it is we don't recognize our own strengths within. And so in the spirit of motivational interviewing, if we recognize and take ownership of our own strengths, then we're able to recognize that in others and give them affirmations they need. And there's different skills in motivational interviewing, and one of the skills is the skill of affirmations. And the research has pointed out that that is the skill that produces the most change, or what we call change talk in clients. And change talk is the word they've coined that goes towards change. So we say that in motivational interviewing, of course, we have our problem lens on. We're looking for problems. But on top of that, we have to have our affirmation lens, where we're looking for any little thing the client is doing well, even if they just showed up, or they made a phone call, or they made one small change. And if we point that out to them in a genuine, authentic way, they're able to start to take ownership and see their strengths, which makes them want to live up to it and do it even better. Because many times people don't believe you when you make an affirmation. And so it does make them want to do it once you point it out to them.
Oh, so interesting. So it's easy to forget our strengths. Where does that come from? Do you think is it hard to remember our strengths? Or because obviously the older you get, the more you go through, and you like, something I'm realizing is people who are older are exceptionally strong because you wouldn't have survived as long as you did without being a strong person, like survival of the fittest, we'll say, you know? So why is it that I guess we have sort of like memory loss with our strengths? And then also, how do you balance out not becoming too proud, you know? So it's like, let's say I passed this particular challenge. I'm not a great person for doing that. How do you avoid being too proud of your strengths, and how do you remember them as well at the same time?
Yeah, how do you stay humble, right? Yeah. Well, I think it's very easy to forget our strengths and forget our successes. And that's why we have that part of motivational interviewing to help people remember all the good that they've done. And, this is my guess. I don't have any research or anything to base this up, but I think it's easy if you don't intentionally stay positive in life. It's very easy to default to the negative, and look at all the gloom and doom. And, I think especially with COVID and all that we've gone on in this world the last 20 months, is how do you intentionally stay positive and see the good in each moment and each day? And one of the things that has been really beneficial to me during COVID is I've been able to train, organizations and people across the United States that I would never have had the opportunity to train if it hadn't been for COVID, with all the virtual trainings that I do. And so I've been, very, very blessed with that, and being in contact with people that, like I said, I would have never been able to have contact with.
Great. So it's like a case of realizing that you have to kind of do the work yourself and spot the strengths that you have, and spot the kind of like a grateful approach to life, like spot the moments where you can be grateful. So yeah, I feel as though maybe we have it too good. Maybe our generation is just like too fortunate with the quality of life we have, that it makes it harder to appreciate the little things which are really important. So you have a wealth of experience with MI. How long does it take someone to become skilled at MI, and what are some of the kind of the basics that people should learn to try and get better or to get more skilled with MI?
That's the golden question. Well, Bill Miller was asked more than a few years back, well, what's the difference between knowing MI and being MI? And he said, about 10 years. So motivational interviewing, it's a language, just like any other language. And we say it's similar to learning a foreign language or playing a musical instrument like the violin. And so you can't learn to play the violin in a couple days, right? And I think the problem is a lot of professionals come to a 4-hour training or an 8-hour training or a 2-day training thinking they will, become proficient in motivational interviewing, and that's just not the case because of the language. So the start is going to a workshop, seeing, is this something that I want to subscribe to? Is this something that makes sense to me? Is this something that I want to commit a good chunk of time or my life to learning and using? And, I talk to my participants, that's only something that you can decide. And then the way people become more proficient is the coaching piece. And about 7 years ago, I became what's called a coder in motivational interviewing. And there's a coding system that was developed called the Mighty, MITI. And if you want to submit a 20-minute tape of you talking to someone using the skills and the tools of motivational interviewing, it's coded to the fidelity of the language by a coder. And then there's usually a coaching session on it, around it. Because what happens is a lot of times people think they're doing motivational interviewing, they're really not. And so when they hear it for themselves, and then there's a coaching and a concrete coding around it, they can start to see what they are or aren't doing, and then intentionally change things for the future.
Yeah, I actually came across coding in my postgrad, and it was such a new concept to me, but it's basically, you're just trying to like decode some sort of script and trying to find, for MI, I guess it's change talk. So could you talk a little bit about how the typical approach to trying to change people's behavior doesn't work, and then how change talk through coaching, when you become an effective MI practitioner, is more effective? The difference between the two.
Right. Well, people have a lot of ambivalences about their behavior change. I know I should exercise, but I'm just so spent at night, right? And so that statement has what's called change talk and sustain talk in the same sentence. I know I should exercise. That's the change piece. But I'm so spent after work. That's what's called the sustain piece, or status quo. Now, a lot of times someone will pick the sustain piece part and say it back to them because they think they're being empathetic. Well, they are being empathetic, like, oh, it's, you're so tired at night, it's so hard for you. But what happens when someone hears that, they actually can become more committed to their ambivalence, right? To the reasons why they're not changing. So we say in motivational interviewing, because they're intertwined, pick out the change piece and say that back to them. So they hear that piece, not the struggle. So, on the one hand, you're tired at night, but on the other hand, exercise is really important to you, and you're trying to figure out how to put that into your schedule. Or you could just say the second part. You realize exercise is important to you, and you're wondering how to put that piece in so it's a regular part of your routine.
Great. Yeah, that makes me think of a few things. So it's like, I know I do that myself a lot. A client will say, had a tough weekend, I was feeling sick, or the weather was crap, or whatever is going on. And I'll be like, yeah, that is tough. Like that would make any change in your health behaviors challenging. Mm-hmm. But as you've just said, that's sustain talk, and that promotes the status quo. Right. And then it makes me think how, in MI, you want to think of the client as the expert, but I know myself, I come in with the bias that I'm the expert. So with MI, you're coming in a more collaborative approach. So how do you know when I guess, what is the change talk to look for, so that you're not being biased? You're not trying to push someone they don't want to go, What would be very clear examples of change talk? Just could you recover that?
Well, sometimes it's not like in your face clear, but it's the skillful piece of MI of looking underneath the words. So if someone says, I'm just really struggling with exercise, they want to exercise because they're basically saying that. So you can say, what's underneath? What's the hope? So you're really trying to find the path that's going to work for you to create sustainable exercise for the future, right? And so always looking for the hope, always looking for the change, always looking for what's underneath. And a lot of professionals, when they're learning in motivational interviewing, says, well, I'm putting words in their mouth, or, I don't want to guess, but it's a guess, it's a hypothesis. And that is okay in motivational interviewing if you have the spirit. If you have the spirit of partnership and collaboration, because if you're wrong, the client will correct you because they sense that. And guess what? It's even better if you're wrong, because they'll give you more information about what's important to them and what they need. So guessing isn't a bad thing. It's good either way.
Yeah, and then because you're collaborating, you're coming from the right place. You're not trying to push them somewhere that you think is the right way for them to make a change. It's more like, I'm going to make an educated guess based on what I know about you and the fact that I care about you as a client, and we'll figure it out together. Mm-hmm. Yeah. So some of the common things you see are like the writing reflex. Can you talk about the writing reflex, which is like, I feel like pervasive in society? Everyone is guilty of it at some point. and other things to look out for that don't use the spirit of MI?
Mm. Yeah, the writing reflex is a big one in terms of I know best and I'm going to tell you what to do. And that's, like you said, very pervasive, especially among healthcare professionals, is not listening to people and listening for their motivation and listening for what would help them and then saying it back to them and thinking that they know best. And the problem with that is um, patients sense it and they leave feeling very uncomfortable. And a lot of times they won't say back to that person, well, this isn't going to work for me or this offended me. They just won't come back, right? Because that person injured the working alliance. And I think, one of the most important pieces of motivational interviewing is the listening piece. And, that word is so overused. And I find in my trainings, many will say, I thought I was listening, but I was listening with the intent to ask a question or give a response. I really wasn't listening with the intent of reflecting back to someone's motivation of what's important to them and what would help them.
So you mentioned a double-sided reflection. Is that a more effective way to listen and have a conversation with the spirit of MI? And could you just kind of define that?
Sure. Well, there's the main, what we call micro skills of motivational interviewing, and we call them OARs: open questions, affirmations, which we talked about, reflections, and summaries. And a reflection is basically a summary back to someone what they told you. And it's summarizing their words, but really the more effective type of reflection is summarizing what's underneath their words. We call it a simple reflection or a complex reflection. And there's like 7, 8 different types of complex reflections. You can reflect someone's emotion, or you can reflect the autonomy piece of, what they're trying to say. I mean, there's like multiple ways. I'm not going to get into them because it's, beyond this podcast. But a double-sided reflection is where you can either reflect both sides of the ambivalence. On the one hand, you're really worried about your health, and on the other hand, you're really struggling with this behavior. I like to reflect the sustain talk, the struggle on the first part, and the change talk on the second part, because the client will talk about the last thing that you said. So do you land on the change piece or do you land on the sustain piece? So I'll give you an example. On the one hand, you're really having a hard time thinking about quitting smoking. And on the other hand, you want to breathe easier. What's the next thing they're going to think about or talk about? Breathing easier. Now, if I switch it and say, on the one hand, you want to breathe easier, and on the other hand, you're really struggling with quitting smoking, what's the next thing you're going to talk about? So part of motivational interviewing is being intentional about your words, but also intentional about the placement of your words.
Yeah, words have so much meaning. And I feel like we're kind of dancing around doing the role play we discussed, going into an example for people to listen to about how words can have such a benefit. And just something as well I'm thinking of is, let's say you have a relationship with a friend or your partner or a client, whoever it is, and you're speaking to them and you have this bias in your head, they need to make a change. I feel like a certain pressure comes with that, and it's not really that nice. It's kind of like, if only they could be this way, if only they could be that way. And it kind of gets in the way of having like a genuine connection with the person. And the thing about MI is that you're collaborating with the person. So it actually gets rid of that kind of pressure or tension or just lack of authenticity that should be there, that by default we kind of just get rid of. So I think it'll probably come up in the role play. But the role play was just something I've been thinking about as a health coach, is to write more health related articles, research based articles that would have, as we call it in when you're making content, is like more of a shelf life than say like an Instagram post, for example. A blog post is going to be around for a lot longer. It can be a lot more detail, but I'm ambivalent about getting started. So I was thinking we could use that as the template for a role play, and Susan could use her skills as the expert or the collaborator, and we could see, where it takes us.
Sure, sure. Okay. Well, tell me a little bit more about that, Ross.
So I have been to college, and I like to think I have a good understanding of the research in health and training and nutrition. And I like to communicate it to people and, educate people, but it's a lot of work. I don't know, are people really interested in it? I don't know what I really enjoy it. And sometimes it gets a bit too technical. So that's kind of where I'm at.
So you're kind of thinking about a lot of things that are getting in the way of you wanting to do something you think might be helpful to people.
Exactly. Yeah. I know I'd enjoy it, but I can think of a lot of, let's call them challenges to actually making it happen.
So your focus has been on the challenges rather than the thing you truly want.
Exactly. Yeah. Because a lot of people who I'd look up to already do this, and I'd aspire to be similar to like my role models and have similar behaviors as them. But I've allowed myself to focus on the challenges.
Yeah. And you're wondering if you have anything to add to what they have already said.
Exactly. Yeah. Because my role models are more experienced than me. They've been doing it longer. And I guess you have to start somewhere, but I just haven't let myself get started.
It's almost like you're forgetting that different people have different brains, and one person's brain may connect to one of your colleagues and another person's brain may connect to yours.
Yeah. And there's definitely, friends or kind of people who follow me. Like, my following is not large at all or anything to write home about, but there's definitely people who like what I put out, and it'll only grow if I start. But if I don't start, it's going to, as you said already, the status quo will be maintained.
What do you think gets in the way of you writing a blog post?
Definitely planning, I think, if I had a plan that would get the ball in motion, and then upgrading my website as well is a big one. I think having a hub for where you would put health education content is somewhere that would just make it much more accessible. And actually there's sites like Medium, for example, where I could start.
So having a concrete plan and then a beautiful site that really captures all the essence of who you are, that you could be proud to put that blog post on.
Yeah, exactly. Yeah, just putting everything that I know and I'm passionate about related to health and fitness in the one place. Because my main hub is kind of like Instagram. I do have a Google website, but it's not as sophisticated as something like yours, where you have your blog posts. And it's interesting, now that we're talking, I know the ball is rolling, and I'm talking with a lot of change talk in what I'm saying. So yeah, I feel as though I could start with something simple like Medium, and then when a website seems like a more appropriate, a more advanced website like yours, it seems like a good idea. I'll make that change.
Yeah, so you could see where that could be a good first step to be a bridge towards getting you to the place that you want to go.
Absolutely, yeah. The ironic thing is, if a client is making a change, I don't know, have you noticed this, but a client will, ask for advice or just talk about a change they want to make, and they'll say, I haven't been working out or eating like I would have hoped. I'm going to go 100% all in and make this extreme change. And I know intuitively that's not a great way to start. You're biting off more than you can chew. So using a site like Medium, where it's like, as far as I know, a free service, and you can upload it like relatively easily, very easy to use, is like a nice small step in the right direction, as opposed to like, paying someone to get a website when I'm not fully convinced that it's the right way to go.
Yeah, it's the manageable part of getting to where you want to go.
Yeah, it's like it's a manageable step in the right direction, as opposed to like jumping in at the deep end and feeling pressured to post onto a website that is harder to drive traffic to than social media. And also the money aspect of it would put me under kind of like an external, I'd be externally motivated by the money when I want it to come from within.
Yeah, it wouldn't feel so forced.
Yeah.
Yeah. Yeah.
Yeah. I feel like that was very productive, and we literally talked for like not even 5 minutes. It displays exactly how MI is so effective.
Hmm. Yeah, and it's in your heart to write. So part of it is how do you do it in a way that makes sense to your brain so it feels more organic, right? And it doesn't feel so like forced and like this huge boulder. It feels more like a little soft snowflake, that you could actually wrap your head around.
Yeah. I don't know if you know about the self-determination theory and how it
Of
talks
course.
about autonomy and how
Mm-hmm.
important autonomy is. And that's, of course, a big part of MI, where I wouldn't want to make content and do it because, oh, this other personal trainer is doing it, or because I feel compelled to do it. I want it to come from my own motivation and feel like I have control over it. So, yeah, I guess that's kind of what we talked about a little bit there, where it's manageable and I'm doing it in my own way.
Yeah.
And it goes back to one of your points about the client has to make the choice themselves. I love the saying, you can bring a horse to water, but you can't make it drink. Yeah. I feel like that comes up in MI a lot. So the skills are absolutely vital. So are ORs, they're the micro skills. Are they the kind of fundamental skills people should learn when first learning MI, or would you recommend starting somewhere else?
Well, the beauty of MI, there isn't one right way to learn it or thing to focus on, but really, if someone wanted to start somewhere, the spirit is the place to start of the partnership piece, um, the collaboration, the kindness, the compassion in their conversations. And it's interesting because Bill Miller and Terry Moyer, who's one of the main researchers in motivational interviewing, they wrote a book that came out about 3 months ago on what are the 8 attributes of helping professionals. And within that, there's a lot of motivational interviewing in their book. That the the piece of empathy is number one, and then genuineness on the part of the professional, um, kindness, compassion, evoking someone's wisdom. It's all tied up in there. And so, if you learned oars, if you didn't have the spirit, that those skills would be lost. Right. So I just usually recommend people start with the spirit and then really work on becoming proficient in oars, maybe with a tape, maybe with some coaching. Of course, going to a workshop first to get an overview to see, is this something I really want to subscribe to?
Absolutely, yeah. Like one of your workshops is it gave me such a good start with MI. Do you think MI can be used in your own life personally? So, for example, in your own talk within yourself, like in some quiet time you might have, or maybe if you're journaling, and do you think it could be used in like, friendships and relationships, or is it just best kept to your work and work with clients?
Hmm. Very good question. The thing about using MI with family members or, someone who's not a client is usually we have an agenda with our friends or spouses, partners, and that makes MI null and void, right? Because you cannot have an agenda. You have to stay completely neutral, right? For example, my husband doesn't like to exercise. And so I cannot use MI with that because I have an agenda. I want him to exercise and be healthy. But if he says to me, can I have a MI conversation about something with a client or something else? Sure, I can stay neutral, right? Because I don't have an agenda with respect to that. Um, with respect to yourself, it's a little harder because, how do you reflect your own thoughts? The only way is there is a book by one of my fellow trainers, Alan Zukoff, and it's called Finding Your Way to Change. And he talks about how you can use MI with yourself through journaling. Right? And, it's a very good book. So if someone who was interested in using MI, but I think it's a good idea if there's something you're truly ambivalent about, you need some help, to seek out a motivational interviewing practitioner. You can go to motivationalinterviewing.org and find, there's about 1,500, we're called mentees, motivational interviewing network trainers, and find someone that you feel comfortable with.
Brilliant. Yeah. Well, of course, attach links to your site and your work as well, and that book and anything else you think is relevant for anyone listening. So just going back to your own work, you work kind of like in, I feel like, the most challenging situations, like with people with addiction. I got really interested in addiction over the pandemic. I just found it fascinating how you can have kind of like everything in your life, but you could have something missing. And for example, self-compassion, to put it like lightly, and that could, result in you having an addiction, meeting your needs in unhealthy ways. Could you talk just a little bit about the work you do, why you enjoy MI so much, and then just maybe some of the kind of information you've learned about addiction? Because I feel like it's becoming more talked about, but there's not a whole lot of experts speaking about it.
Yeah, addiction is such rampant in our culture, and addictiveness in many areas, alcohol, drugs, even, workaholism, right? All these things, and people, there's something inside that they're not addressing, right? And so that's where a motivational interviewing conversation can help with that, can help bring that out, and that it's really has to be done with someone who's very skilled at MI and works either very skilled in MI and addictions, or of course very skilled in MI. And so I train a lot of different organizations in motivational interviewing, mental health professionals. One of my favorite contracts is I work with the VA addictions physicians and social workers in Arizona, and training them in MI about how to have conversations with their population, which is very challenged, with the vets and families of the vets who have multiple addictions, lots of drug addictions and alcohol addictions. And so that's been challenging and also really wonderful to work with them and see the progress that they've made in helping that population. Right. And then one of my other contracts that I love working is the Navajo population and all the healthcare workers that that work with the Navajos with their not only addictions, but the rampantness of diabetes. And there's something called an A1C, which is your 3-month average blood sugar, which is supposed to be 4 to 5.6. And the average A1C for a Navajo is 13. So it's like, they're walking around with blood sugars of 4 or 500. And so these physicians, nurses, dietitians, doctors are trying to help them in the best way. And so I've been working with training them, mostly they work in Arizona and New Mexico on those tribes, and helping them help those people with having better lives and taking better care of themselves, lowering their A1C, helping with addictions, etc.
That's great. Yeah. I came here thinking America's like the land of opportunity, but minorities, unfortunately, they have like a very tough time kind of, I guess, fitting in, and they have a lot of health problems, such as what you've mentioned. But you can make great progress with MI. What are like some of the success stories you have, and like what change could a practitioner or a client expect to see, for example, if they worked with you directly, or if they learned MI and they worked with clients? What's like a realistic change you could see?
You mean in people who are learning MI, or?
With clients, in terms of let's say, for example, I have never learned MI before, and then I apply it to working with my own clients. What change could I expect to see? maybe in
Mm-hmm.
myself, in my own practice, or in the actual outcomes with clients?
Mm-hmm. Well, motivational interviewing is a game changer. Um, and I think when someone handed me the book in motivational interviewing, I'll date myself in 1996, all those years ago, I never dreamed that it would change my life in the way it has. And I feel like it's rocked my world in terms of changing how I am, who I am, how I work with people, how I operate. It's changed everything. And so, but that's me. I subscribed, as my husband says, I drank the Kool-Aid all those years ago. And I just can't imagine that if I hadn't drank the Kool-Aid, what my life, I'd be kind of a boring dietitian just telling people what to do. And, you know, no one wants to be told what to do, especially what to eat. Food is very intimate. And so it depends on someone's level of commitment. Is this something you're going to subscribe to, drink the Kool-Aid, and commit to learning it? Because it's not easy. It's not an easy language to learn. You have to intentionally really work at it, do tapes, get coaching, and if you do commit to doing that, it'll be a game changer for your practice. Um, Clients, they don't know what I'm doing when I'm doing motivational interviewing, but they sense it, they feel it, they feel the hope, they feel the difference. And they usually point it out. Even parents, when I'm seeing children, they'll say, "Can you teach me how you just talked to my kid and how you got them to say what they said?" Like, well, it's a little harder than you think, right? But and there's some research that shows of 100% of people who go to MI trainings, only 15% will learn it to fidelity because of what I just told you. 70% will say, "This is amazing. I love this." But they hit a point where it's just too difficult to put the time in and they abandon. And then the other 15% say, "This isn't not for me." So I ask people in my trainings, do you want to be part of that 15%? If you do, it's not an easy road, just like with learning any complex language or playing a musical instrument. But like I said, it's a game changer, and you have to decide, is that something that's going to work for you and make sense to you?
Yeah, you really have to commit to it. It just reminds me of something I hear a lot of people and clients say is like when they go to their doctor, their doctor often says if they have something like a condition similar to like type 2 diabetes, the doctor will say, can you lose weight? And it's a very kind of like directed sort of like, one-sided bit of instruction. And it's never really a case of like the doctor saying, what would you like to do? And I feel as though that's something so simple. And that kind of spirit of MI, the collaborative approach, is like so effective. And it's something you can kind of look forward to once you learn MI, that you take the pressure off yourself as the quote unquote expert, and you kind of share it, because the client's only going to change as much as they want to change. They're not going to be forced.
And you bring something up that the research shows that when a practitioner learns motivational interviewing, there's much less burnout. Because we don't have to come up with the solutions, we just have to evoke them. Right.
Yeah, that's part of what brought me back to MI. So I have my own coach, but she just reminded me of MI, and it made me think of it is work. Any change you want to make is going to be work, but it's very effective, and very sort of. I feel as though it empowers you and it gives you a lot of confidence in what you're doing, because you have all the skills you've talked about. And just something that I'm thinking of is that in psychology, for like a therapist, when they're learning how to work with clients, it's said that they have to do a lot of work themselves, like, on their own biases maybe, or just on their own skills. With MI, is there a lot of work that you had to do initially to learn it? And did you learn kind of like anything about yourself along the way that you hadn't previously been aware of?
Well, we say with motivational interviewing, it's a no judgment zone, right? There's no judgment. And so if you have any judgment, it has to be completely out of the room, outside. And um, I think one of the reasons that we all go into a helping professional is, we want to help people. And, I was the cheerleader for change and, you can do this and, this would help you. And I think the thing that I had to learn in motivational interviewing is that's not the way to help people. Um, so I always say, put your pom poms down, right? And if you want to truly help people, you have to do it in a different way. You have to find their motivation and say that back to them and stay away from the praise statements because that does not work. Right? And that's one of the main things that I had to work to put that aside and put my own self aside and what I think could truly help someone. And sometimes, it's hard when someone comes up in with a, terrible diet and a high A1C and you're thinking, oh yeah, all that juice you're drinking or all those processed foods, you just gotta put it aside because many times someone is carrying a load or a trauma in their past that I have no idea about. And so I have to start with a clean slate and give as much empathy and understanding to their situation so that I can truly be in the spirit of MI.
Yeah, you don't really know what someone else is going through. So it's like you're actually over assuming by thinking that you can come in with like a quick solution of make this change or make that change. So
Yeah.
typically, is there a certain type of client that you have the most success with MI? Is there like a certain kind of trait or characteristic that uh, the results are better among clients?
Well, we say we don't have to use motivational interviewing in someone who's very motivated, who just says, okay, I just need this. That actually would frustrate them. So the the type of client that motivational interviewing works with is anyone who's ambivalent. Like I really want to do this, but I just can't, and I'm not sure how to get there. So it's kind of deciphering the roadmap, but also like unpacking the pieces of the puzzle of what's getting in the way of them doing what they truly want to do. Right? That's the beauty of motivational interviewing, and that's the perfect type of client. So when people say I'm your hardest patient, they come in and think, oh, wonderful. Let's unpack it together. Let's figure it out.
Yeah, there's more potential there. So
Mhm.
with ambivalence, will you just go into that a little bit? Would it be fair to say that everyone has ambivalence in their life in some area, but just more in some areas and less in others?
I think we're all ambivalent in many areas, especially when something feels so difficult in our heads. And there's one really wonderful piece of motivational interviewing that we say is the more a client talks about their ambivalence out loud, the more it unwinds for them. And a motivational interviewing practitioner, when we help unwind that ambivalence by helping them talk out loud, we can help them get to the place they want to go without much. Like one of the things that I have struggled with is mindfulness. I know I need to do it, but it just feels like one more thing on the to-do list, right? Or sorry, meditation. It's meditation. And so recently, over the summer, there's a fellow trainer that I co-train with on some things, and he came to one of my trainings. I came to one of his trainings, so we could learn how to co-train together. And so I was in a breakout room with some women who were very new to MI, and I was talking about my ambivalence with meditation. And it was so interesting that as a trainer, just me talking out loud about it, I'm like, oh, got off the training, downloaded an app. Like, wow, this really works. And I know it works, but when you actually experience something that quickly, you realize, wow, this is why I do what I do.
Yeah, sometimes you can be your own worst enemy. Um, so I think shame and guilt are like kind of powerful motivators, maybe to like sustain the status quo. Could you talk a little bit about that, and if it ever comes up in your work with MI with your clients?
Well, I mean, we try to stay away from pathology and focus more on strengths and solutions, right? So yes, people can stay stuck in behavior because of shame and guilt. And, we never shame people or guilt them into anything. That's completely opposite of motivational interviewing. But we try to reflect the hope piece. On the one hand, this has been really challenging for you your whole life, maybe because of the way you were brought up. And on the other hand, you're here because you're wanting your life to be different, right? So we would soften the former piece, soften what their experience. I mean, we don't want to soften their experience, but soften the intensity in a reflection to reflect the hope piece, so that lands as a stronger component.
Interesting. Yeah, I like how you focus on the positives because, as I said, like shame and guilt are a powerful motivator, and to just not really focus on them too much can really give more power to their strengths, people's strengths. So, in terms of your own work, what's like the most enjoyable part of doing MI, and what are some of the best kind of results you've had with clients?
Well, the beauty of my job is I get to use MI all day long with my clients, and I get to train people in it the other days. So I use it pretty much all the time. And I was thinking about this when you asked me to do the podcast, is um, it's such a beautiful thing when you're training people in MI to see the shift in realizing they can help people in a different way, and it takes the pressure off of them and does it in such a kind, loving way that it leaves them and their clients in a better space. And in trainings, I watch people's eyes just go, wow, I've been doing it wrong my whole life. And there's a better way, a more loving way. And that's the beauty of training, and the beauty of clients is just being with them in that sacred space of where they want to go and giving empathy to their struggle and pulling for the hope piece that they so want to leave with. And they haven't experienced that, or especially in the last, 20 months, it's led to a lot more hopelessness. So helping people with that hope piece wherever I am, that drives what I do and who I am.
Brilliant. Yeah, it's almost like you've made MI your own, like you've integrated it into your character, which is amazing. And the the whole piece, I feel as though, yeah, the lockdowns and the pandemic have really sapped people's hope, and people are suffering a lot. And in compassion, I've heard it defined as self-compassion, or just compassion in general, defined as to be with the suffering you're feeling.
Mm.
So, how has your work changed during COVID? And also, then an article you had is controlling what you can during COVID. How has it affected your work, COVID overall? And then focusing on kind of like the controllables as you had in your post. Could you speak a
Yeah.
little bit about both of those?
Well, I think people have felt completely out of control because nothing has been in our control in terms of, you know, um, masks, vaccine. I mean, it's all over the place in terms of shifting messaging we've received. And, we were living our lives, one day, and the next day it was completely changed. I remember leaving my office on, March 10th, thinking, oh, I'll be back in a couple weeks. And 20 months later, I'm only working, in person one day a week. And the rest of my work is completely Zoom and phone. Uh, which has been okay, and I think people are getting used to it and they actually like Zoom because they don't have to worry about all the traffic and getting to my office in Los Angeles. So that's been a positive thing. And if you're truly present on your Zoom calls, of course, it's always best to be in person, but you can still convey presence and empathy on Zoom calls in a way that I never even imagined. COVID really hasn't affected my work, except in a positive way with being able to train so many different organizations that I had no contact with before. And I think a lot of my clients who went away actually came back because they didn't have to deal with the driving issues in Los Angeles traffic. And I think they are all sensing the need for normalcy, or they want normalcy and empathy. And they don't know that I do motivation interview, but they sense it. So part of what I usually say to people is, can you give yourself empathy to whatever you're feeling so you can move forward? And I think that's one of the messages of motivational interviewing and helping people through this time is giving them empathy, but also or showing empathy, and then talking to them in such a way so they have more empathy for themselves in the process of all that's going on.
Yeah, that's great actually. So, and very relevant to have more empathy, especially during a challenging time like uh, during COVID. What are some ways people can be more empathetic with themselves and with others as it relates to MI, like kind of in the spirit of MI?
Maybe going back to the role play you and I had is like taking off harsh expectations and being more gentle, because change usually comes from a place of love and gentleness rather than, driving the whip, right? And, doing one little thing they can do each day rather than a huge laundry list of expectations.
Yeah, that's very relevant. I feel as though I try and do too many things and I end up getting nothing done relative to my expectations. So that's very practical because there's time in everyone's day to do like one effective task, but I think the culture might be to try and do too much or bite off more than you can chew, and then you end up really getting nothing particularly effective done. But I think that's all the questions I have, Susan. Is there anything you didn't get to discuss that you'd like to go over?
No, that's good, but I'll leave you with a quote. There's a man who wrote a book. This is not motivational interviewing, but a lot of what he says kind of intertwines. His name is James Clear. He wrote a book called Atomic Habits, which you might know about. And he has a quote in the book that says, Rome wasn't built in a day, but they were laying bricks every hour. You don't have to do it all in a day. You just have to lay a brick. Right? So we're laying a brick with ourselves, with each client, um, helping them just a little more each day get to the place they want to go.
Yeah, kind of like just gentle baby steps, almost like what we talked about in the role play, where I have a little small step that I can take that I'm much more excited about than setting these rigid, harsh, big expectations that are almost like not even actionable. So yeah, this has been very useful. Susan, do you have anything kind of coming up that you want to talk about or mention, or anywhere that people can reach you that you'd like to let people know about?
Just, if you want to find more about my nutrition practice, or better yet, my trainings, because that's what excites me. I have a lot of upcoming trainings on my site. I haven't posted the ones for January yet, but I will shortly. And if you just want to know more about motivational interviewing and the skills, I have a motivational interviewing blog, and you can read about a lot of the different skills of motivational interviewing, which will give you a taste for, is this something that you want to subscribe to or not? Um, and of course, I have all the usual social media platforms, but just kind of look around, see what you like, see what makes sense, and go from there.
Yeah, for sure. YouTube is a great resource for motivational interviewing videos, but nothing replaces the real thing. And I got a lot of value out of the workshops that I did with Susan. And then also just, as you can see there from the role play, we only talked for 5 minutes, and I found it like profoundly refreshing and effective. So I'm a big advocate of MI, and I'm motivated now to learn more about it. So thank you very much for your time, Susan. It's been great to chat to you, and maybe we can have you on again to go over maybe some more advanced techniques related to MI.
Thank you, Ross. I really enjoyed it. It was my pleasure.